The disease is spreading. Some 3,400 people, mainly in West Africa, have now died of the Ebola disease. Spanish Health Minister Ana Mato has said that the nurse who was treating the two priests, Manuel Garcia and Miguel Pergeres, has now contracted the Ebola disease. The two infected priests were travelling from Sierra Leone to Madrid in Spain, where they ultimately infected the nurse. Personally, I think that anywhere that has the disease should be quarantined, and no one should be allowed in or out of the infected areas for fear of spreading the disease further. But as we know now, because of the two priests, the virus has gone intercontinental. Blood, vomit, and saliva are three main ways with which the virus can be spread. Eyes are also a high contact risk area, as a sneeze into the eyes of somebody with the virus can spread it. People working with others who have the virus are in a high risk factor, so laundry, clothes, medical equipment, etc. that are contaminated should be incinerated for safety. Symptoms include bleeding from the eyes, nose, ears, mouth, and rectum of a sufferer. If any contaminated droplets do come in contact with your skin, wash immediately with hot water and soap or an alcohol-based sanitizer. Ideally, suits such as this should be worn. They should be changed every 40 minutes with the aid of a helper buddy, and changing time can take 5 minutes. Doctors also say that the virus can live up to 3 months in the semen, so those recovering should wear condoms when having sex. Restricting access to people, places, or equipment that have become contaminated are all ways of reducing the spread of the virus. Healthy eating and drinking salt water are two ways that people thought would reduce the spread of the virus, but the World Health Organization has found that doing so in high temperature areas can be dangerous, as 2 people in Nigeria have died from doing so. People have also thought that dead bodies are safe, but it has been found that even after death, the virus can still be active. Others thought too that health workers brought the virus to affected areas, but it has now been learned that the hunting of small rodents such as rats, shrews and bats have been more likely the cause. If you are in close contact with people who have the virus, regular washing with clean water and soap is recommended. And the use of alcohol gel hand sanitizers is also recommended by health organizations.